had a facial fat transfer about 6 weeks ago. It improved my facial balance, especially on my profile, where my chin and my lower lip were out of balance with the rest of my face.
I could have done it with temporary fillers, but then I would have had to have at least 15 syringes of filler injected to my face every year for the rest of my life, which not only costs a fortune, but I wouldn't want to have to put myself through that every year. With fat transfer, the correction will likely last an entire lifetime, and if I do it again, it's because I desire even more correction than I already have. Fat transfer involves taking living fat from one area of your body, so in my case it gave me a flat stomach too. You don't look like yourself for the first 2 weeks after a fat transfer, since the fat causes a lot of swelling as the face tries so hard to care for the new fat, which has no blood supply. Since 75% of the fat always dies, you start out with 4 times the amount of the fat in your face than you need. Most of the transplanted fat dies within 10 days, which is when you start to look like yourself again. There's a newer option for those patients who cannot afford the time off to recuperate for 10 days. You can inject Allofill 3 cc's at a time and just correct one area at a time. Generally, you look good within 24 hours. To achieve the equivalent degree of correction I achieved with a fat transfer, I could have injected 10 syringes of Allofill. Benefits of Allofill would have been that I could have injected just one syringe at a time, and that after just every injection, I looked good the next day. Thus, I could pay for whatever my budget allowed at the time. Benefits of fat transfer is that it costs less when you are getting a large amount of fat transferred. Downsides of fat transfer is you have to do it all at once to keep that cost down.
Now we add growth factors to the fat so it nearly all survives, so we only inject what you need and the swelling is therefore only mild and only for 1 week.